I have the sarcoma. Please like and subscribe to my channel. Hello and welcome to my channel. This is just a warning that today I will be showing you pictures of me after surgery and with a hole in my eye socket. And also to say I am not a doctor. However, I will explain things without the surgical talk. Today's video is to talk about a debulking operation. That's what it's called in the UK. I don't know about other countries, but in the UK it's called a debulking operation. I've been asked about this a few times and I want to just explain my story, what a debulking operation is, so you can understand. I can guide you through the operation process, and if needed I can connect you to individuals who have had the debulking surgery, but I actually haven't had the debulking surgery yet. I'm not sure if I ever will, but it's always an option. Even though I'm going to talk to you about the debulking operation, first I need to talk to you about the free flap operation, because you can't have the debulking surgery without having the free flap. My free flap was taken from my calf, and a vein was also taken from there, which the doctor used a vein at the back of my head, which isn't a common thing for this kind of surgery, but due to the radiation damaging my veins in the surrounding area, all the veins that they would have used were damaged. So he tried a new surgery, and I'm glad to say that it worked. As the radiation had killed my veins, it had also killed my skin, and a hole was opening up in my eye socket that grew and grew and grew. It grew slowly, but it was still growing. At the time that this happened, there wasn't an option to have a flap because all the veins around my eye that they'd have used were dead. Actually, the veins were dying and a fresh blood supply couldn't get through anymore. At the time, a flap operation was out of the question because all the veins that they would use were actually damaged by the radiation. Just by chance, the surgeon found a new type of flap operation using a vein at the back of the head. And so that's what he decided to do. He'd never done the operation before, but I had faith in him that he could do it. It was during COVID, so I couldn't see him, and we talked over the phone, and I recorded him a video of me blowing bubbles out of my eye socket because my nose is now connected to my eye socket. So I did a video for him to see, and I thought, do you know what, I'm going to post it on TikTok, and it went viral. The hole slowly grew for about a year and 3 or 4 months before I had the operation. There's also talk that if the operation didn't work, I might have to have my eye socket completely open all the time. But my surgeon was like, that won't happen, I'll find a way of covering it. When you discuss having a free flap, the doctor will also discuss with you a debulking operation. The main thing is, from the surgeon's point of view, is getting the flap done and making sure the vein is healthy and your body doesn't reject it. And after, they can then go back in and do a debulking operation. Debulking actually describes what the operation is about. And basically, they go in and take all the bulk away from your free flap and make it smaller. Sometimes when you have a free flap, the surgeon will put more skin on than is actually needed. If you have the eye removed like mine, because I had the whole socket taken out, they can sometimes put fatty tissues inside the eye socket. Sometimes they dissolve, sometimes they don't, but the surgeon doesn't know that until you're fully recovered. So because the surgeon doesn't know what will happen, there is a plan to go back in and do a debulking operation. And there may be other factors, depending on your circumstances. They may need to go in and do another operation. They may want to take your cheekbone out. I have seen some people have the flap down to about here, but again, it all depends on your treatment. The surgeon's priority is to get the flap to take. So that means it needs to heal up, the vein needs to be healthy, and supplying the skin with a fresh blood supply. And because it's your own skin, your own tissue, and your own vein, the chances are more likely that it will take. However, there is a small chance that your body will reject it, but your surgeon will talk to you about that. Please take a minute to like, share, and subscribe. I am told that if the free flap doesn't work, it kind of goes all black and drops off naturally. Thankfully, that didn't happen for me, and the skin flap operation went very well. It was just very swollen after surgery. Probably wouldn't have thought that it would look as good as it does now. The surgeon has to do a bit of guesswork because everything swells. It's very hard for him to tell if the skin will be extremely big or too small. The only way he can really tell is by the swelling going down once the skin flap is taken. Sometimes after a free flap surgery, you may have a lot more skin than you need, but please don't worry about that because they can go in and do the debulking operation. They also need to leave a bit of skin for leeway. If, for example, your stitching comes away in one area, they will need enough skin to stretch over that area to cover it. As the surgeon said to me, they can take things away, but if they take too much, they can't put them back. These are big operations and we want them done properly and as best they can. So if that means we need a debulking operation, then so be it. I'd prefer to do that than be left with a hole in my eye socket. I've not had the debulking surgery because I don't feel like I need it right now. My surgeon was on about doing a mini facelift with the debulking, but as it stands, I'm okay with how it is now. Sometimes they use the debulking because you may want a prosthetic eye. Now, to have that in place and not stick out too much, they need to do the debulking surgery so you have a little bit of a dint in your eye socket where the prosthetic eye sits. Once that's been done, they can then look at making the prosthetic eye, which will line up with the rest of your face rather than sticking out. But again, I'd already had a prosthetic eye after my original operation and I didn't like it. But I do know a lot of people that do. So if you are wanting a prosthetic eye, I would recommend that you do try it because a lot of people have found that they give them confidence. With my free flap, I can still wear glasses. It doesn't get in the way of the glasses at all. Therefore, I don't feel the need right now to look into the debulking. Some people will have such big free flaps that they can't wear glasses. However, because I can, again, I don't feel like I need the debulking right now. And that's the thing, it's never going to look perfect, but I can function with it how it is. It's not in my way, and I can still wear glasses, which actually help protect my other eye. Plus, it's a flat surface, so I can put makeup and things on it, and I can stick things to it. I've found all sorts that I could use as an eye patch, and I've stuck it on my skin because my skin's flat. When I originally had my eye removed, my eyelids were just sewn together. What I didn't realise is because the socket was empty, it pulls in the skin in the surrounding area. So my eyebrow is actually in my eye socket a bit compared to my other eyebrow, which is still where it should be. I don't know if you can tell by me doing this, but I've got like a little crease at the top of my nose. That's partly because the skin has been sucked in to my eye socket. And also, there's times where I have pictures taken and I think I'm smiling, but unbeknown to me, not only am I smiling, but on that side you see a bit of the tooth, and that's because all the skin has gone up and into my eye socket. That is partly what the surgeon is talking about a facelift for, to make all my face the same. Because you can tell that there's a difference between the two sides of my face. But right now, I don't think it's a problem. If I do that, I get loads of wrinkles. And my forehead is wonky. I always imagined getting old and having wrinkles and how wonderful it'd be. I just never thought, one, I'd have so many, and two, they'd be wonky.
Looking back, I think my face was always kind of wonky, but it would all be corrected within my debulking operation.
I hope that has explained what a debulking surgery is. And please don't panic the day that you have surgery and you look at it and think, wow, this is huge, because it will go down. And the part that doesn't, that is what a debulking surgery is for. And if you're still here, please subscribe. It really does help me grow. Thank you.
I have the sarcoma. Please like and subscribe to my channel.